I've never seen these videos. This is the first time that I've seen them. They were sent to me. So this is a Fertility Doctor blind react to gynecology TikTok. Here we go. Okay, there's so much stuff on TikTok. These videos were sent to me, so I've never seen them. So this is gonna be my first time reaction. We'll do a little bit of probably cringing together, I don't know, and I'll educate you as we go. So here we go. It's TikTok time. All right, got my phone.
Why were we never taught this in like health class or something? This is so important. And let me tell you something. I wish I had known this before I picked all of mine off because I thought they were like pimples or something. Now I'm gonna stop talking and let you listen to the lady.
She picked them off.
The oil actually contains an enzyme that kills bacteria and keeps the areola moist. Our favorite word, am I right? Women have about 9 glands on each areola, although some women have none and others have up to 38. Most moms even notice that their Montgomery glands get bigger during pregnancy. And what I think is most cool, it's thought that the oil secreted by these glands smells like the amniotic fluid your baby has lived in for the past 9 months.
Wow.
This smell helps guide your baby to your breast to initiate breastfeeding for the very first time.
Wow.
Okay, so Montgomery glands are sebaceous glands, so they're oil secreting, so they can lubricate when you're breastfeeding. And they do have scents that are familiar to the baby. So some people have said that this smells like amniotic fluid. So that's not actually wrong, even though it's really weird, right? But really don't pick them. They are normal. So your breasts are supposed to have these little glands, these little bumps around your nipples. So please don't pick at them. Okay, next. Okay, that was really fast. So I'm going to freeze it up here. So this is a common thing with birth control pills. So they can make some people feel better and some people feel worse. Again, birth control pills have an estrogen, which is pretty similar across the pills, and a progesterone. And the different types of progestin, which is a synthetic form of progesterone, they impact the body differently. So mood symptoms can happen, and that's what she's talking about, feeling depressed or not feeling like herself. So even though hormonal contraceptives can help for bad periods, you might need to change. Often with my patients, we go through a series of trying different pills until we find one that makes them feel the most like themselves. But they do really help your periods. You have less menstrual tissue grow, you don't ovulate, there's less lining to shed, cramps get better, and less bleeding. So they can be really useful to treat medical conditions. However, you have to be patient and try different ones until you find one that works for you. Yes. Oh, this one hits me like hard because I see so many young women who've never been given the permission to talk about their periods, ever, ever, ever. And so they don't know how to cope. They don't know how to talk to people. It's a really tough thing. Your first period is such a whirlwind of emotions, being excited and nervous. And I really feel like we need to talk about periods and vulva, the outside of your anatomy, and vagina, the inside of your anatomy. Because if we don't talk about these words, we are isolating further generations of women and we're not opening the door to talk about our problems. Your periods cramping can hurt, but if it is limiting your ability to do activities, something may be wrong. You should not cancel school or work or cancel plans with friends because you're on your period. If your period is impacting your life, something is not normal. Okay, this video is a little scary, and I've actually had this one sent to me multiple times wanting comments on it because this big long needle and this camera, is that what getting an IUD is like? No. So the thing about the IUD is a little T-shaped device. Okay, and it has little strings at the end. So what happens is that the IUD goes inside the uterus, and there's two main different types. The IUD is made out of plastic. It can either be wrapped with a copper wire, and that's called a copper IUD, or it can secrete progesterone, so a long-acting progesterone secretion. These two things live inside the uterus. So it's a T-shape to fit inside the uterus, and the strings come out the vagina. So in the perfect world, you should pull the strings when you're ready for removal. So whether it's you're ready to get pregnant or because the IUD's been in long enough, when you pull out the strings, it should be an easy removal. That said, sometimes the strings are missing or lost. So there's a couple different causes. The number one is that they just curl up and hide inside the cervix. So that's not problematic, but it can be hard to remove. Honestly, when that happens, when I see a patient like that, I'm going to take like little pap smear brushes and tiny little things and try to just like reach right in the cervix and see if I can fish them down and grab them and pull them out. But if I can't, yeah, you may have to go to hysteroscopy. Well, like that looks really scary with the big needle, with the lidocaine and the hysteroscope. Hysteroscope is a camera that goes through the cervix into the uterus to show you the uterine cavity. That's often done when you're asleep. So the whole needle situation looks a little scary. This is an in-office hysteroscopy setup, which means on the pro, you don't have to have anesthesia, but on the con, you have to numb the cervix so you don't feel pain. Nobody wants to feel pain. Needle with the lidocaine does feel like a bee sting. There's that. Not everybody does that type of procedure where they numb out the cervix. So that's just one place where they're doing it. That is not common. Strings are missing about 5% or so of the time. The other thing that can happen is the IUD could move and migrate through the uterus. That complication happens about 1 out of 1,000. So that's not a common complication. It's actually where the IUD migrates through the uterine wall. Maybe it was at time of insertion or who knows, but it ends up in the abdominal cavity and you have to have an abdominal surgery called laparoscopy to go and get the IUD. The other thing is that the IUD can just expel itself. So if you have a lot of bleeding, super heavy bleeding, sometimes you can have the IUD actually come out of the body. And that's why we see women go in for string checks to make sure that the strings are actually in place after having the IUD placed. Side note, do not call the strings, maybe this is for healthcare providers, like healthcare providers. Do not call the strings penis ticklers or anything that's presuming that somebody is having heterosexual relationships. That's inappropriate, number one. But number two, not every woman who gets an IUD is getting it for contraception. So let's be really inclusive in our language.
If you don't have a vagina, you're going to be very confused by what I'm about to say. But is no one else completely terrified by the bleaching properties of a vagina? Like, how does she do that? I guess I'm about to show my underwear on the internet, and that's because I am comfortable with who I am as a person. Prefacing this by saying these are clean underwear. Like, these are black underwear. Ba-bam. How? Pink. How? How does she do that? Like, what?
Oh my God. First of all, I love that. How does she do that? Your vagina maybe needs to come with an owner's manual, like an owner's manual to your vagina. Number one, your vagina cleans itself. So you don't need to clean it. It's a self-cleaning machine. It regulates itself. When you put things inside of it to clean it, you are actually dysregulating its normal properties and its pH. One of the ways it stays clean is that it's acidic. So the pH of the vagina is acidic, and that can have bleaching properties, especially if you wear darker underwear. So your vaginal pH is acidic, and that can cause the normal discharge. Remember, WAP, 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 normal to have discharge. It is normal for your discharge to change in regards to your cycle. When you're about to ovulate, your body's making an egg. That egg makes estrogen. Estrogen causes the body to have really liquidy discharge. It thins out the discharge so that sperm can swim through there. And that type of discharge is going to cause some WAP. If you don't know what that is, you need to Google it. Also, when you're sexually excited, you're going to have an increase of blood flow to the glands that secrete more fluid in order to have lubrication for intercourse. So that's all normal. And your vagina's acidic, so it can cause staining. But oh my God, I love that she just showed her underwear on the internet. Like, that's so good. So good. Thank you guys so much. Hey, this video is recorded in a time of a lot of uncertainty in our country. We don't have election results right now, and I know that's leaving a lot of people, myself included, with a lot of anxiety. No matter what, it's important to take care of yourself, and I'm just sending you all a lot of love. If you want more fertility-related information, you can always listen to the As a Woman podcast. I have tons of topics, and if you subscribe to this channel, that would be great, so we can share more fertility-related information to everyone. Thanks, friends.